Hi, I'm Dr. Craig Walker with Walker Family Chiropractic. Today's video, I want to talk for just a couple of minutes about HBOT, Hyperbaric Oxygen Therapy. What is it? What is it for? Have you ever heard of it? Some of you may have heard of it from 1930s when they were treating patients with the bends from being too far below the water, or for decades with using traumatic brain injuries. Now the truth is, this therapy has been used for decades with all sorts of different challenges, health challenges, symptoms, diagnoses, and with some amazing results. Now if you want to jump ahead and do a little research of your own, because you know, I've got this disease, I've got this disease, I got this disease, and I have 30 seconds to figure it out. Well, jump right on the internet right now and type in your diagnosis and HBOT. All right, or your symptom, HBOT, Hyperbaric Oxygen Therapy, and see what comes up. All right, so what is it? It's basically a chamber. There's a couple different types of hyperbaric oxygen therapy chambers. There's hard ones that tend to be in hospitals, and then there are what's called soft chambers, and that basically just looks like a big pill with a tube going in one end into which we pump air. All right, so what's it for? So what it is, first of all, it's a tube that you get into, we pump air into and increase the pressure. So as you're increasing the pressure far up from normal atmospheric pressure, what it does is it shoves oxygen into your blood and into all the rest of the tissues in the body, from the top of the head in the brain all the way down to the bottom of the feet. What would the benefit be for having excess oxygen or extra oxygen in the body that your body can't get into it all by itself? Well, the byproduct of extra oxygen is going to be wound healing, nerve growth, 8,101 genes turned off and on over a period of 24 hours. Those genes that you're turning on, they reduce inflammation. And they also turn off the genes that aggravate inflammation. So those are both good things. Why would we be concerned about inflammation? Again, inflammation goes down as a result of the body having more oxygen pressurized into the whole body. And what might that help with? If you're suffering from, or you know somebody suffering from neurologic conditions, whether acute or chronic, maybe diabetes, chronic fatigue, or other autoimmune conditions that you've been struggling with, autism potentially, depending on why it is that the body is struggling with some of these sensory processing disorders, traumatic brain injury or concussions, or maybe you've been in a car wreck or 2 or 3 or 4 or 5 in the past where you smacked somebody or somebody rear-ended you. And then you've got 2 types of injuries, acute injury as well as the injury that happens afterwards. Both of them are going to have an inflammatory component. Both of them may very well respond favorably, and you're going to hear my language there. I have to be very careful with what I do and don't say online like this, because I don't want people to be misled. Just like any other doctor with any other medication or any other suggestion or approach is, there are no promises, right? We don't know if hyperbaric oxygen therapy is going to cure this or cure that or cure this, because only the body cures itself. But it sure does a lot better when it has access to a lot more oxygen in there. Right? And that's why we're offering that here in our office, because really no side effects come along with this. And if there are some, we're sure to cover those in the office. Usually it has to do with you being able to adjust to pressure changes, like going up in an airplane. All right? So some of the next questions we're going to cover in videos that we're now in production with, but just haven't posted them yet, are: how does it feel? What is it like to get into the chamber? What does it look like? And you may see some pictures online. How does it feel while you're in there? How long do you need to be in there? How many sessions would you need to come before you can expect to notice some changes, have the changes be permanent? Is there a difference between adults and kids? What if I'm claustrophobic? How often do I need to come? What might it cost? Those are all fair questions. We'll be getting into those in future videos. But again, check out the link down below, and I make myself available for no-charge phone consultations. So if you have questions for me directly, if you think that this or maybe one of the other services that we offer here in the office might help you, I'm happy to spend some time to talk with you to figure out whether or not we think we may be helpful. Thank you for watching.